Hello there. I didn't see that you were already in here. You must have got in real quiet. How are you doing today? It's really good to see you and great to have you in once again in my doctor's surgery for the ultimate health checkup for you in terms of the normal things that you get done annually. So we're talking cranial nerve examination, we're talking eye examination, and we're also talking ear examination with a little bit of sensory examinations added in there as well, such as smell. This is going to be the sort of ultimate compilation for the doctor checkups for you, to give you peace of mind, to make sure that your health is in tip-top condition. It always is every time that you come to see me. So we're trying to make this as pleasant for you and relaxing and make sure that you feel at ease. So how are you doing today? You're doing good. A little bit tired. That's great. That's perfectly fine for coming to the doctor's surgery. You can feel a little bit relaxed. Normally people don't. So it's great that you've acquired that skill to come and see a doctor and feel totally relaxed, totally at ease. If you want to fall asleep, you can. This is also a sleep clinic. We specialize in sleep therapy and things of that nature as well, which you have come in to see me before. We offer different sort of hotels that you can come in and fall asleep, etc., etc. So I've got my handy keyboard here. So let's get this open and just check that all of your details are up to date on the system. Okay, there we go. And open up there as well. Okay. So it's all nice and on. So we'll just log in there. Okay, turn on the computer. Right. Okay. So what I'm going to do, I'm going to connect this to that screen there. I've turned it around so you can see everything that I'm doing there as well. Also, I am going to change the screen as well, split the screen so you can also see it there at your leisure. So if you're looking left and right, you can see everything that I'm updating here and there also. So everything's still the same, contact details still the same. Oh, you've moved house. Oh, excellent. Well, I hope that's gone really well for you. And so what does that do? Okay. Oh, it's really lovely there. Oh, amazing. I'm very happy for you that, yeah, that's really nice there. So I expect you being quite busy, but still found time for me. Great. Right, and your checkups. Right. Okay. It's in there. And mobile phone number still the same. Yeah. Okay. No, that's fine. Just. Yep. Yep. Excellent. Okay, thank you. Just add that in there. And your email address. Okay. Excellent. Well done. Thank you so much. Okay, so that's all in the system state. So as you can see on the screen just over here, that we've got you in for your eye examination. So this is the sort of normal things you would expect from eye examination. It's really going to focus in just on it's a detailed overview, shall we say. So there's nothing invasive or intrusive, but it's going to be very meticulous in its overview. So then that's going to be sort of the main checks. So you've got all the systems, the procedures that we'll do here. I say procedures, just the tests that we're going to be doing. And then if you want to gaze your attention to that screen there. So we've got your ear examination there as well. Just little things that we do here. So you can see here, we just do a little test there, and like with the sounds and things next to it, it's very relaxing. It's very nice. And if you look, let's have a look at the screen again. If you just look over there, and that's part of the cranial nerve examination. So the cranial nerve examination, that's not going to be a full-on meticulous cranial nerve examination, but it's going to be all of the bits that surround your head, and we'll focus on just all those tiny muscular details there, and how your face moves as well and feels. And it's just a basic overview check. Everything's sort of in sync with each other. first. So it's a nice test that you've come in for today, and I don't really guarantee this to anyone, but because you've seen me for quite some years now, that it's going to be probably relaxing for you. So you're an expert at this as much as I am. You can feel relaxed, at ease, and we'll just go through it together. Okay, we try to make things the nicest, do it the nicest way possible here for you. Okay, so both the screens up there and there. Let's turn the brightness down just a little bit on that one, and turn the brightness down a little bit on, oh, that was up, down on that one. Okay, so alright, nothing's too bright for you. Perfect. Okay, so you have a choice what you'd like to start with today. It could be the eye examination, the ear examination, or the cranial nerve examination. Okay, so we'll do the eye examination, and then the ear examination, cranial nerve examination. Well, there we go. That's what we want. Okay, let's get that in there, and then I can just close that there. It's very handy, these keyboards, and then all I have to do is just lock it in there, and it's very compact. I can keep it in my pocket. It's very useful. Okay, so let's start with your eye examination then. So what I'm going to do first off is get my gloves on. I'm going to have a look around your eyes, and I'm going to shine just a little light in there, and it's not going to be too invasive. And then I'm going to do some various tests for you to have a look at. So I'm just going to come close first without the light. I'm just going to have a little look around your eye here. Okay. Right, just around your eye. Yeah, that's all fine there. Okay. It's always good just to give the patient a nice check first before the light goes in there as well. You can also see quite well without the light as well. So I'm just looking around your eyes here. Okay, that's very good. Perfect. Right. So I'm just going to take a light here, and we're going to adjust it, and then we'll start with your right eye. So we're going to come in closer and closer and closer here. There we go. So I'm just coming in close and looking in your pupil. Okay, and checking that's all looking healthy and very good. Now the colour of your eyes is very nice and nice white colours in there. Okay, around the eyes, right. And that's looking good. Thank you. Sorry if it's a bit close there, okay? So again, just going a bit closer in there. Look in your eye. The pupil is looking good. And one in your eye also looking very healthy there too. Okay. So if you just look straight on there for me. Thank you. And straight on again. Thank you. So I'm just going to turn the light off and turn it on and off, okay? You just look straight ahead for me, just straight down there. Be perfect, thank you. Okay, and again, a bit closer. Perfect, okay. I'm just going to do it with your right eye. You just look straight on there for me. I'm just going to turn the light on and off. Right. Okay, and a bit closer. That was very close. Perfect, thank you so much. Great. Place that in there. And your eye is looking really good there. So I've got a slightly brighter pen here. And what I'm going to do, I'm just going to shine this pen, move it around. You know how this operates, don't you? Okay, so I'm going to ask you to look at the tip of the pen. Okay, the tip's going to move around. All you need to do is just simply look wherever it goes. Follow it with your gaze. Great. So look at the tip of the pen. Okay, that's really good. Okay, thank you. Thank you. Do really good. Really good. Okay, it's going to keep moving. Okay, it's going to keep moving. Excellent. Well done. cover it up, expose, cover up, expose, cover up, expose, cover up, expose, cover up. Excellent. You're reacting perfectly to the torch. That's really good. Torch is going to make some very, very simple shapes right now. Just like you to tell me what you see. Very basic shapes. What do you see there? A square. You got it. Isosceles triangle. Well done. It's going to go down there, back, down here, up there. Yep, rectangle. Well done. Now, finally, if you just let me know what you see here. Okay, yeah, just keep looking there. That's really good. Well done. That's very good there. Very nice. Yeah, just keep looking. That's very good there. Well done. If you just keep looking wherever the torch goes. Alright, that's really good. Okay, if you just let me know what you see here. Okay. I know it's very crude. What do you see? Imperial Star Destroyer. Excellent. Right. So what I'm going to do is come a little bit closer with this. I'm not going to use the torch. I'm going to use the torch on this. Okay. I'm just going to shine the torch just around, so I can see your pupils move and follow the light. So keep following the light. 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 Perfect. Okay. Just keep following the light. Keep following the light. Keep following the light. Perfect. Keep following the light. Keep following the light. Keep following the light. That's really good. Perfect. Keep following the light. Keep following the light. Keep following the light. Well done. Keep following the light. Keep following the light. Keep following the light. Keep following the light. You know what? I think you've done this before. That was very good. And everything for your eyes there, in terms of the light, is just as we wanted. Okay. So I've got some very basic charts here, which I'd like you to have a little go at, and just tell me what you see. I'm just going to simply point at these charts at different distances from here and further down in the surgery there, and then I might ask you to read the ones that we got all the way over there as well. So we'll get our first chart. Okay, this is a numerical one. I'm just going to point, and you just let me know what you see. What I'll be doing for pointing is shining a torch at the back of the chart. Okay, thank you. 5, excellent. 2, 8, excellent. 3, well done. 6, excellent. 9, of course. 5, indeed. 6, well done. 2, let's see if we can go a little bit lower. 8, excellent. 2, well done. If you can do the very bottom line for me. 2, 3, 6, well, certainly no problem there, which is really good. Now, it might get a little bit trickier because there's going to be a little bit of a colour difference here. So, I've got some numbers here that I'd like you to have a little look at for me. Okay, and just tell me what you see. Thank you. And the colour of the number, so you could just see where I'm underlining here. Perfect, thank you. So, what do you see here? 53, and the colour turquoise. Excellent. So what do we have here? Number 12, and the colour light green. Excellent. If you just let me know what you see here. Green and 64. Excellent. If you could just let me know what colour and what number do you see here? Order 66. Excellent. Well done. That's really good. And it can be a little bit tricky with the different colours, but you're doing very well. What number do you see here? Number 10. Excellent. And what number do you see here? 75. Orange. Excellent. What number do you see here? 68. Orange. Excellent. You're doing very well. What number do you see here? 29. Blue. Excellent. Well done. And what number do you see here? 31. Yellow. Well done. You're doing very good. What number do you see here? 73. Turquoise. What number do you see here? 80. 21 yellow. Well done, you're doing really good. Tell me, what number do you see here? Colour, orange, well done. And what do you see here? 70 and purple, blue. It's sort of in between that a little bit, more on the blue side, but yeah, that's the whole point. It's a little bit tricky, this one. And what number do you see here? 97. Pink, excellent. That's really good. So I've got just a little pointy stick here. You just tell me, what do you see? What shape? Okay, square, oval, triangle, star, hexagon, diamond, rectangle, heart, trapezoid, and what have we got? Pentagon. Okay, now I'd like you to just tell me, what colours do you see here? Okay, 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 right, okay, okay, well done, well done, okay, excellent, well done, perfect. There. I'm just going to hold this back a little bit further. So if you can tell me, what planet do you see here? Then you can read that. Neptune, well done. And Earth, excellent. Can you read that? Mars, well done. Can you read that? Saturn, well done. Uranus, well done. Jupiter, Venus, see that there? Mercury, and perhaps this really big fiery one here, the Sun. Well done. You've done very well with that, as expected. So I've just got some glasses here, so I'm just going to place that on you there. Okay, now all I'd like you to do is just tell me, how many fingers am I holding up, okay? 4, well done. 1, 2, okay, excellent. 5. Thank you. So I've just got another pair of lenses here. Now can you just let me know if these lenses you can see better or worse, okay? Right, how many fingers am I holding up? 10. Do they look better, more clearer, or is it a little bit more blurry? A bit more blurry, okay, let's just take that up. There, thank you. You're doing very good. And I'm just going to take these glasses out here. So I'm going to just place these on, okay. So I'm going to hold some fingers up now, just let me know when you're ready. You see 9, okay, and is that clearer, is that better or worse? Okay, it's about the same, okay, what do you see here? 10, excellent. 7, 2, 2, 4, well done. Well, that's perfect, because what do we have there? For those glasses, you had a clear, you had one which had a slight optical lens in there, so that probably was a little bit more blurry for you. Yeah, and that was a clear one there as well. So just to make sure there also, so you can take a look at the screens here. I'll just put everything that you've just done on the screens here. Okay, so what do we go through there? A little habit of just moving, pacing around a little bit, just helps me concentrate a little bit better. Okay, you can just alternate whatever screens you like, so just keep adding everything on there, keep adding everything on there. Perfect. Adding it on there, adding it on there. Excellent. Now, part of your ear examination requires me just to come a little bit closer now. Okay, so what I'm going to do is take just a little look in both your ears, look down your ear canal as well. So I'm just going to come close, very close now. Okay, now, there we go. So hopefully that's not too much pressure. If it is, then of course just say, but it should be perfectly fine. If you feel any discomfort, then by all means please let me know. Okay? Well, that's all looking healthy. I don't even see an earwax build up at all, which since your last ear examination there could have been a slight build up of earwax. Everything's looking very clean and very healthy there. That's very good to see. Okay, just have a little look in the other ear here. Okay, so same again. I don't see any earwax in here, which is really good to see. And it's all looking nice and healthy. There's all the right colour in there. Very good, very good. Excellent. That is very good. Well, just in that time since your last ear examination with me, that would be enough time for earwax to somewhat build up just a little bit. So there isn't even that, which is very, very good to see, which means you've been really taking care of your ears and cleanliness there as well, which is really good. Sometimes that's what we do. Sometimes we forget we're not as meticulous, or we use earphones quite a lot and get a little bit of earwax build up, but with just a nice gentle care and washing and around the ears, and this would all help with internal as well. So that's looking really good. So we'll just do some little examination things. Like I said, this is like a meticulous overview. So we're going to go in with all the key things that I would like you to do for an examination, but we're not going to be entirely thorough with it all because we just want to make sure that everything is good for you. Alright? So just going to come close to your ear. Yeah. Okay, I'm just going to feel around your ear. Okay, just feeling around. This is checking your ear health. Okay. And you must excuse my very unappealing hands for cream or do nothing to them. You get the hint of cold weather, and that's that gone. That's it for the season. Used to be Agent Callus, but now it's just splits and dry hands. So yeah, your ears are looking in really good health. So I'm going to feel in both of your ears here. Just what I'm doing is just feeling around the edges, like around the pinna, around the earlobes, just gently press it in a little bit. Okay, so I'm just going to press around pinna here. Okay, all right. Is that feeling all right there for you? Great. Now just on your earlobes a little bit there. Okay, how's that there for you? Okay, so yeah, that's feeling perfectly fine to me. So I'm just going to apply a slight bit of pressure just up your ears. Just let me know if that feels all about the same there. Okay, you don't feel any discomfort there at all. None there whatsoever. They shouldn't hurt at all. Yep, that's fine. That's fine. Good. Okay, I'm just going to hold that a little bit there. And there, how's that feel? That's really good. Well done. And there. Doesn't hurt at all. Perfect. Excellent. Well, that's just checking your ears and basically the exterior. And that's all looking very good to me. So we're going to make a couple of sounds now. And I'm going to alternate between your right ear, your left ear, and right ear. I'd like you just to tell me if you feel or hear any difference in the sound which I make. You keep your eyes open, you can see what I'm doing. You don't need to close your eyes unless you want to. And just let me know if you hear a different level within each side for me, okay? So these are the normal medical things that you'll find in the doctor. So we start off your right ear here, okay? How's that sound with both sides there? About the same, perfect. Okay. So I've got some tweezers here. I'm just going to make some little clippy noises on both sides. We start with your left ear this time, okay? Just some plucking noises. This is very clippy. Okay. Okay, and on this side. Would you like me to do that again? Okay, certainly. There. And there. About the same, okay. There. There. About the same, perfect. So I've got something here. Over there. Any difference there? About the same? Perfect. So I've got a little bit of a different sound here. Okay. So if you just let me know, I'm going to place it close to your ear here. And okay, about the same. About the same. And how about this? About the same. About the same. Perfect. And how's that for both ears, for your left ear and your right ear? About the same, perfect. And finally, the most important test and sound of them all. So if you just let me know if this sounds about the same, okay? It's going to come a little bit closer. Hello there. Hello there. How was that? Was that about the same? Okay, and what about this? Hello there. More on your left ear, okay? Hello there. Hello there. More on your right ear, okay? How about this? General. General. Okay, about the same. Excellent. Well, we can place that just over there. And you have done exceptionally well with the ear examination part again. So what we're going to do, get this open, and we'll just put all of your results down here as well, just on the screen to see how well you've done. Again, once again, you do so well with all these examinations. You really are upon natural with this. Plus, looking really tired and sleepy during the process. It makes my role as a doctor a lot easier. Okay. And we'll just put the down there, numbers, and procedure, and that's going to be updated. There and there. Okay. So, do you remember the last thing we're going to be doing? Indeed, cranial nerve examination. So, like I said, this is going to be a little bit of more of a focused overview of the cranial nerve examination. So, just to do all the main checks here. Okay. So, if you can let me know when you're all nice and ready for me. Excellent. So, what we're going to be doing is going a little bit closer, and I'm going to just feel the side of your head, okay? So I'm just going to feel down here, feel down the side of your head, okay? I'm going to do some gentle taps here, okay? Tap on your face there, and tap on your face. How does that feel? About the same, okay? And about there and there, how does that feel? About the same, okay? I'm going to feel top of your forehead now, top of your forehead. I'm going to feel the top of your forehead, okay? Everything's looking fine. Then I'm going to do a gentle tap here and here. How does that feel? Okay, and what about here and here? How does that feel? About the same. What about there and there? How does that feel? About the same. Okay, I'm going to ask you just to push down your eyebrows. I'm going to try and lift them up, okay? And I'd like you to fight. Okay, ready? Fight, 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 fight. Perfect. We're going to alternate that. I'm going to push down your eyebrows and you're going to try and lift them up for me. So you do that and then fight, 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 fight. Perfect. So I'd like you to clench your teeth for me, okay? Clench your teeth, clench your teeth, clench your teeth. That's really good. Now, excellent. Now I'm going to ask you to open your mouth wide for me. Nice and wide. Yeah, excellent. And then close your mouth. Okay, we're going to do the same again. I'm going to ask you to open your mouth. I'm just going to resist and fight that and try and close your mouth. Okay, so open your mouth, open, fight, fight, fight. Excellent. I'm just going to pull your chin down a little bit here, okay? And if you just try and close your mouth there, okay? Fight, 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 fight. Excellent. That's really good. Okay, I'd like you to smile, grin for me, wide as possible. Thank you. Then I'd like you to close your face, frown, make it all angry looking, very angry. Okay, yeah, no, that's good, good. Okay, now relax, relax, relax. Okay, now make it as angry as possible. Okay, perfect, perfect, perfect. Clench everything, and now relax your face. Perfect. That's really good, really good. So I've got my cranial nerve instrument here. So what I'm going to do, I'm just going to do a soft feel there and a soft feel there. If you let me know if that feels about the same. Okay, just gentle tap here. Okay, gentle tap and a gentle tap there. How does that feel? About the same. What about if I do it there and there? How does that feel? About the same. Okay, so what I'm going to do, I'm just going to run my hands down your face here. Okay, just checking and making sure that everything feels as it should. Okay, which is feeling good there for me. Okay, so we won't do any more close eye examinations at this point, purely because we've already just done a pure eye examination, and I have reason to suspect that we don't need to look further into anything. Okay, how does that feel? All about the same there. Excellent, that's really good. Okay, so what I'd like you to do is just a simple part of the test there for me. I'd like you to just look directly at me, okay? I'd like you to touch your nose and then touch my fingers wherever it may go, okay? So like this, like this. I'd like you to keep touching wherever it goes, like that, and back to your nose, okay? So it's very, very, it can be a little bit tricky, but it's a simple procedure, okay? So touch your nose, touch your hand, touch your hand, touch your hand. That's good, that's really good. Okay, perfect. You can do this very fast. That's really good. Okay, that's really good. So if you can tell me which finger do you see move, keep looking at me. On the left, okay? On the right, okay? On the left, on the right, on the left. Both. Excellent. Well done. On the right, okay? On the right, on the left. Both. Excellent. That's really good. So we're just going to do a little bit of a resistance thing again. So I'm going to just push your head a little bit, and if you just lean forward and try and fight and resist that a little bit, okay? So if you just push, 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 push. Excellent. Okay. Now I'm just going to hold it at the back of your head. If you just lean back a little bit. Perfect, perfect. That's really good. Thank you. And just a little bit for the upper part there as well. So I'm just going to ask you to put your hands out like that for me. I'm just going to secure my hand against your hand here and just resist. If you can just push out like that, then I'm going to try and resist and pull it back in there for you. Okay, just let me know. There we go. Thank you. You're a lot stronger than you look. Okay, with your right arm there. Okay, just put it out like that, and I'm just going to try and push it back in there for you. You resist, resist, resist. Excellent. Now I'm just going to try and pull it out, and you try and bring it back in there for me. Okay. Excellent. That's very good. Excellent. That's really good. Okay, so if you just put your hands out there, me like that, keep looking directly at me. Just keep looking directly at me. Okay, so I'm just going to do a couple of soft movements on your hands. Okay, does that feel alright? Okay, keep looking directly at me. That's really good. That's very good there. That's very good there. You can do some gentle taps on top of your hands there and there. Okay, if you can just turn your hands over there for me. Okay, I'm just gonna. Okay, and like that. Okay, and then just gentle bit there, gentle bit and there. Okay, okay, another tap there. Excellent. Well done. Another tap there. Okay, if you just move your hands around like that. Perfect, that's great. So yeah, you can just put your hands nice and relaxed, and now literally just on the top of your leg. Now I'm just going to gentle tap here, gentle tap here. Okay, and I'm just going to do a little tap here, your leg moves here, and just a little tap here. Okay, just one more here, and one more here. Okay, and if you just do a little bit of resisting here for me, if you can just lift your leg up for me whilst you're just sitting down there, just lift, and I'm going to push it down. Perfect, thank you. And if you do the same again, lift. Perfect, thank you. And just going to do it one more time. Thank you. And one more time. Excellent, thank you. So I'm just going to have a close up, very close up look here, and just have a nice check. Your face, all around the outlines, looking fine. That's all looking good to me. You've never had any injuries that I need to look at around your face. So from a neurological point of view, everything is looking as it should, which is very good to see. That's looking good there. Right. Okay. And that's really quite good to see there also. Well, guess what? You've done another amazing job at the surgery here against the doctors, and doing your eye examination, your ear examination, and your cranial nerve examination. You must be very proud of yourself by always doing so well with all these things, but also getting it checked as well. And we take it very seriously to create a nice relaxing atmosphere here for you. Being sleep specialists, we want to make sure about all things that, because sleep is the foundation of everything in your health, and it's that time for rejuvenation, relaxation, and for you to feel good. So if I can make that happen here, and we can do that here for you, then that means you will have a very relaxing examination, whatever needs to be done here. You can feel at ease and almost a bit of a safe space for you, which is what we want. Okay, so what I'm going to do is just going to type up all of your things here. Okay, that's up there, and the number of things we did there. So go through numbers. So everything is now on the system for you to look at if you want to, and come in, book appointments whenever you wish there too. Perfect. Well, you're looking quite relaxed and tired now, so whatever you do next, just be nice and nice and relaxed, and if you need to be, okay, and if you don't need to be, then be nice and alert for whatever you need to be doing as well. Okay, so sleep, when it comes to sleeping at night time, it's very important that you feel nice and relaxed during that process. Well, I have been the doctor here at the surgery, and I hope that I've managed to do the cranial nerve examination and the eye examination to a suitable standard for you, and you've got everything done that you wanted to. Perfect. It's always a pleasure to see you, always a pleasure to help you, and I hope that everything is going really well for you, and everything you need to do and all the things that you're up to and doing at the moment is going to go well for you, that you're going to feel good doing whatever you're going to be doing, and that you benefit by congratulating yourself, looking after yourself, speaking nicely to yourself, and appreciating yourself, everything that you do. You're doing great. Alright, well, you take good care of yourself. Take care. Cheerio.